I also want to thank you for all the work you do on the opioid issue. Now, I didn't run for governor to work on this thing, okay? It just found me. Anytime I went anywhere where there were more than 15 or 20 people in a room, in a diner, in a restaurant, in a VFW hall, in an American Legion site, in a town hall meeting of some kind, some group of people or some individual would come up to me after the whole thing was over and come up to me and say, so, you're a healthcare guy, right? And I'd say, yeah. And they said, well, I got a brother, sister, mom, dad, son, daughter, boss, co-worker. And then they would tell me about the hell that they've been through. And it felt like that every time I heard these stories. And I couldn't understand why it was that no one would speak up about this when we were having the Q&A in the town halls. And I realized after a while, it's because they were either ashamed or embarrassed to talk about it. So I started bringing it up as part of my remarks. I'd make it one of those issues that I talked about, try and give people permission to speak to it. And I still couldn't get anybody to bite until afterwards. Except afterwards, more people would come up to talk to me about it. So I finally went back to the campaign people and I said, maybe I'm just listening for this. But it sure sounds to me like there's something big going on out here, and it's really not getting the kind of attention that it deserves. Because I'm hearing about it literally everywhere I go. And then I called up some folks I knew who worked in hospital ERs, who were first responders, EMTs. And I said to them, you guys are kind of on the front lines of this stuff. Am I missing something, or is there something going on out there? Because it sure feels that way to me when I'm just out and about. And they all said some version of, yeah, it's a calamity, it's an avalanche, it's a catastrophe. I mean, really sort of out there kind of language to talk about this. And I said to almost all of them, well, you've known me for years. You know I'm running for governor. How come you didn't talk to me about this? And I got some version of I'm just trying to keep my head above water. I'm just trying to manage it as best I can, and I really don't think anybody cares very much about this. And then I got the data back from the folks on the campaign about the double-digit increases in overdose and deaths and prescriptions that have been going on for decades. The data that showed that 4 out of every 5 people who ended up on heroin started on prescription pain meds. The fact that we'd written 240 million opioid prescriptions in the United States in 2014. And then I spent a weekend when I was riding around visiting folks, trying to get their attention. That's what you do when you're running for governor. Reading a book called Dreamland by a Los Angeles Times reporter named Sam Quinones. And I happen to think that book is in many respects the sort of the most accessible and comprehensive story of how we got here. And I would recommend it to anybody who's looking to read something that will really give you a sense about what happened over the course of the last 20 years. And then when we won by some small miracle, and it was kind of a small miracle, the lieutenant governor, who's from Worcester, by the way, points out to me on a regular basis that we won the election by 39,000 votes, and we won Worcester County by 47,000 votes. Therefore, Worcester County, we lost the rest of Massachusetts. We won Worcester County, and we as an administration should never forget that. But we went at this issue right away, and we put together a group of people, and we built our approach to it around prevention, education, treatment, and recovery. And then we worked it through the legislature, and in the end, everybody voted for it. It was unanimously passed by the House, unanimously passed by the Senate. And on the prevention education side, it had to do with educating folks in schools, prescribers, people in athletics. And we're still the only state in the country where you can't graduate from medical school, nursing school, dental school, pharmacy school, or social work school without taking and passing a course in opioid therapy and pain management. And we're the only state in the country where if you're a prescriber, you can't get relicensed without taking and passing a course in opioid therapy and pain management. We rebuilt our prescription monitoring program, did a ton of outreach to middle school and high school athletic departments, increased our spending on treatment and recovery by about 60%, opened up about 1,100 new treatment beds, tried to make sure those were in areas where we needed them, dramatically expand the use and availability of naloxone. I mean, really went at this. And in 2017, while the news is still bad, for the first time in a decade, instead of having double-digit increases in deaths and overdoses and prescriptions, we had a 10% drop in deaths, a leveling out of overdoses, and a 30% drop in prescriptions. And we still have a really long way to go on this one, as you all know better than most. And we have a second piece of legislation that's currently pending. It's called the CARE Act, and it does a lot of things, but the one thing I'll speak to tonight, because it's particularly important, I think, to the next act in this, is it creates a credentialing model for recovery coaches. And I've really come to believe that recovery coaches have an enormous role to play in helping people get into treatment and stay clean. And a lot of the folks who are in recovery want to be recovery coaches and use this as a vehicle to pay it forward. And because they've been there and done that, they can speak to people who are dealing with this terrible issue in a way that's much harder for the rest of us to connect with. And we've tried some experiments where we've embedded them in hospital ERs just to see if they can actually sort of move the needle a little bit on getting folks who are dealing with this issue into treatment. And we've had experiences where some of these folks have actually gotten as much as 80% of the people they've dealt with to at least try treatment. Now, many of them don't make it, but the one thing I know about treatment, especially when you're dealing with this issue, is for a lot of folks it's going to take more than one time. Sometimes it's going to take many times. And I just want to make a point about this. You know, for my entire life, I was told over and over again that failure is part of success. That nobody gets anywhere that means something and matters without a few bumps along the way. There are old sayings about how setbacks are nothing but steps along the process to success. I mean, we hear all these from the time we're really little. And then we get into this addiction issue, and all of a sudden, if somebody doesn't stick the first time they go through treatment, that's failure. No. It's just one step on the road to success. And if we can create a credentialing model around recovery, by the way, there's a bunch of things we can do to support that with regard to recovery coaches. One is create a reimbursement model for it and make it something that's available to be reimbursed both on the private side and on the public side. You combine that with a variety of different approaches to treatment generally, and I think we can provide the kind of support on a proactive basis that people are going to need to get better. So if you could do one thing for me, it would be to make sure you reach out to the members of your legislative delegation and impress upon them how important it is, with some 90 days left in the session here, that they move that CARE Act before the session ends at the end of July, so we can get into the business of implementing the second act of our approach to prevention, education, treatment, and recovery.